you for tuning in. It is Janet Dermody and Tina Olivero. I'm going to start the show off today with just a short 2-minute video. It's with Global News, and I want you to see this video because everything with the opioid epidemic, the opioid project, started off in British Columbia. They are the leading province that's pushing all of these changes through to the rest of the country. So we figured we were going to start there because it's been trickling through the rest of Canada from there. So in the meantime, let us just add this to the stream. This is Dr. Alice Ferrani. She is the Provincial Health Services Authority of the Opiate Project going on in BC. So let's get her.
Diversion in and of itself isn't something we should think of as good or bad.
Apologies.
That's the view from Victoria on diversion of drugs from BC's Safe Supply program.
I'm going to start her again.
Diversion in and of itself isn't something we should think of as good or bad.
That's the view from Victoria on diversion of drugs from BC's Safe Supply program, where doctors have been giving the opioid Dilaudid to drug users in the hope they'll refrain from using deadly street drugs. Years into the program, the scope of diversion is coming into focus.
What we're worried about and what concerns us is that misleading information could be getting out.
This week, Prince George RCMP say they seized more than 10,000 pills, an unknown portion of which they say had been diverted from Safe Supply. That bust only days after Mounties in Campbell River say they also seized more than 1,000 diverted Safe Supply Dilaudid pills.
The government cannot continue to deny that this is an issue.
They claim that these tax-funded drugs were going to save lives. In fact, it's done exactly the opposite.
Well, those are familiar critics. The PG bust raised the fear that Safe Supply is now being trafficked interprovincially. Alberta Premier Danielle Smith is demanding action, and that province's mental health minister had this to say.
They're likely being diverted to other provinces. So when we see that happen in Alberta, I have a responsibility to my constituents and to our citizens here. We believe Safe Supply is a damaging program.
On Friday, Premier Eby downplayed the Prince George seizure, saying most of those pills were not diverted Safe Supply. A program that his top medical officials not only want to maintain, but expand.
What I can do is assure British Columbians that the prescribed alternative programs, the physicians and the nurses that administer that do everything possible to minimize the risk of diversion.
Paul Johnson, Global News.
So I don't know if you're in British Columbia, make sure you vote that premier out. He got to go. He doesn't seem to be following up with what the medical people are thinking. What did you think of that video, Tina?
Yeah, it's becoming more and more evident. I think like the fact that all of these prescriptions are ending up on the streets and they are using them as a whole other trafficking ring in the country to be able to oftentimes have these Dilaudids ending up in schools with their kids, for example, and it's reaching across the country. We just recently had a great big huge bust here with a Newfoundlander on his way here with a tractor trailer full of drugs. And you have to start thinking, well, the fact the illegal drug trade is bad enough, but now we have Canadian taxpayers' money going towards all of these prescriptions, and then it coming out and being sold on the streets, and it's turned into another whole entire drug ring. So immediately that has to stop. There's no, should we continue to do this? No, it's already been proven. First of all, there's no proof that it's not harmful and doing more damage than good in terms of the person involved taking them. But besides all that, put that aside for a moment, like these are now part of the new drug trade.
Exactly. Speaking of drug trade, I just added into the comments, so how Safe Supply is defined in Canada. And so again, everything's coming from, this is the Vancouver CA. It's a document of Safe Supply. I'm just going to put the link in here because I want all of our sources to be cited. Okay. So it says, Safe supply refers to a legal and regulated supply of drugs with mind and body altering properties that traditionally have been accessible only through the illicit drug market. These drugs include, these are what the government is allowing our doctors to supply to people going into the safe injection and safe supply programs, this is what the drugs are, and it's in the comments. Drugs included are opioids, such as heroin, stimulants, such as cocaine, crystal methamphetamine, hallucinogens, such as MDMA, LSD, and marijuana. Those are what we are paying for in our tax dollars. Now, I don't know you, but that actually just, it makes me sick that we are using our tax dollars instead of helping with recovery, detox, and mental health issues. We are our programs. We are literally buying the same drugs that they're using on the street, and we are supplying them with them. We are the new dealers. Is that the feeling you're getting out of it too?
Absolutely. I mean, I think that first and foremost, you got to ask yourself the question: should we be giving people with addiction more drugs right off the bat? And then when you hear about heroin, meth, MDMA, weed, all of these things being provided, like at the very basic level, I just asked a simple question: does doing more drugs cause more brain damage?
Absolutely.
Does it impact decision making? Does it impact people's ability to actually decide to recover? Yeah, it does. It does. And we don't need a whole bunch of medical studies to show us that. That's just basic common sense. So
have common sense. Apparently, there's a lot of people out there without any sense. I've seen, Tina. They're senseless.
Yeah. And, you got to stop and wonder why that is. Like, what's the incentive? What's the, I guess, what's underneath all of that? Is it corruption? Is it, power? Is it the ability to make more money? Is it a society that's under the umbrella of being compassionate is actually exacerbating the illicit drug crisis in Canada? I think yes, absolutely.
It is. So the next thing that I'm going to bring up, I've put that information in for the safe supply, put that document information in there. We're not going to read that, but what we are going to get to next is going to be the report that was written by Safer Supply Dr. Bonnie Henry. And Bonnie Henry is the one that came out with the Safe Supply program, and this was her baby. Well, that was back in 2019 when, she first put this information out there. Now, let's fast forward to 2024 and see how Bonnie has changed her mind on this program that she helped spearhead. Okay, so bear with me here. I just got to stop this one and start the other one, and we're going to go over this one. So this one's got a lot of doctors in British Columbia signed into it and on with it. Okay.
Yeah, this is a very, very important document, I think, because a lot of the safe supply people keep citing, studies, so-called studies. I don't see the studies. I don't see when you actually ask to dig a bit deeper and say, okay, well, where are the studies? Double-blind scientific studies that these actually work. Well, first of all, we haven't had enough time to even test whether or not this human experiment is going to work or not. We don't have this, most things in FDA that get approved have years and years with, double-blind studies that, have all of these professionals behind it. And when they are absolutely sure it's safe for the public, then we can, it gets its FDA approval. But here, this is complete opposite of that. This is like, we've decided as a government that we're going to dish out all of these drugs without actually recognizing what the consequences are going to be to BC and across the country. It's like, it's one thing to decide for your own province, but it's another to exacerbate an illicit drug epidemic because of this whole prescription, so-called safer supply.
So do you have this document up? Are you able to read it with me?
I am. Yeah, I have.
Excellent. So I'll start here with Dear Ministers. At the very bottom, I'm going to tell you it ends at Victoria Division of Family Practice. You get to that end because I'm going to get you to finish off from that point when I stop, okay?
Okay. So, where do you want me to pick it up?
I'm on page 2. The first page is just acknowledging all the doctors that signed off on it. And then a lot of the end pages are doctors, again, that wanted their names on the report of not approving with the Safe Supply program any longer. So I'm going to end at the the 4th paragraph down. I'm only going to read the first 4 paragraphs and you're going to pick up on the 5th one. Got it?
Sure.
Okay, so this again is Dr. Bonnie Henry's report. It is the review of the prescribed safer supply programs across British Columbia and recommendations for future actions. Meaning from this point forward, this is how they want this program to change, aka stop. So dear ministers, I am a physician in Victoria, BC, and on February 14th, I published an op-ed in Victoria Times Colonist in response to Dr. Henry's review of prescribed safer supply, PSS, in British Columbia. I requested better safety measures and more robust research into the potential benefits and the possible harms of the prescribed safe supply. In the past few weeks, 71 other physicians, primarily from Victoria, have asked that I add their names to the letter and send it along to our elected representatives. This list of physicians includes doctors specializing in family medicine, pediatrics, pediatric psychology, adolescent medicine, addictions medicine, emergency medicine, internal medicine, and hospitalistic medicine. Okay, so they're doctors from every realm of medicine. It includes the medical chiefs of staff to both the Royal Jubilee Hospital and the Victoria General Hospital, the medical lead for pediatrics at the Victoria General Hospital, and 2 board members of the Victoria Division of Family Practice. Back to you.
And then she goes on to say, I am respectfully submitting a copy of the February 14th op-ed, as well as a list of the physicians who supported it. I look forward to hearing your response. Specifically, I look forward to hearing how your government intends to better balance the risk of harms with the potential benefits of prescribed safe supply, and how you intend to improve research in those potential harms. Yeah. And then it goes on to say prescribed safe supply needs a lot more research. And then doctors go on to say, why they believe this to be true. All of these doctors that are listed here. She goes on to say, I'd like to thank Dr. Bonnie Henry, BC's Chief Medical Officer, for her courageous and honest examination of the thorny issue of prescribed safer supply in BC. Although Dr. Henry recommended cautious expansion of the program to include a wider range of prescribed alternatives, it's worth highlighting 3 of her conclusions, which should give us pause when considering further expansion, as they clearly indicate that we jumped the gun on this. First, Dr. Henry reviewed the evidence behind PSS and concluded that the total body of evidence was quite limited. In fact, it is not at the point strong enough for this intervention to be described as fully evidence-based, which is exactly what I was saying. We don't have evidence-based information here. And all of this, you hear the pat answer, and when you're talking to government that, these safe supply initiatives have, doctor-backed studies. Well, you know what? They don't have fully evidence-based studies. And I'm calling on the people who say that they do to actually show us that, because I'm all for learning new things, but all you have to do is look at the results of the country and work back from there. We are being decimated by an illicit drug crisis. Decimated. 22 people a day are overdosing in Canada right now. And it goes on to say the significance of this finding cannot be overstated. PSS advocates, and in particular those who are in favor of prescribed safe supply expansion, have repeatedly claimed that their argument is based on evidence, and that opposition to expanded PSS is little more than fear-mongering, which it is not. The truth is, much of the evidence behind PSS is weak or inadequate, and Dr. Henry has now confirmed this report. So finally, all the doctors are standing behind the fact that we don't have a leg to stand on when it comes to evidence that prescribed safe supply is the way to go.
Yeah, exactly. They're backing it up now. Now they're saying that they feel that it went too far, and now we need to put the brakes on it. And whoa, we need to readdress here. So let's keep going.
Which, in my mind is a little too late, because we have people, including my son, who all across the country have died as a result of this illicit drug culture and the enabling attitude of, just a society that is supposedly compassionate and going to give people more drugs to kill themselves with. Like, it doesn't add up on any level to me. It's like all roads lead to continuation of using drugs rather than recovery.
Yeah.
So, even a recent much cited study in the British Medical Journal, which showed that drug users have a lower chance of death in the 7 days after receiving PSS, is underwhelming. As any doctor will tell you, 1 week mortality benefit, while positive, is never used as a measure of treatment success. People care about patients being alive 1 or 2 years down the road, not 1 week after the use.
Exactly.
So there's all kinds of holes in this so-called proof of concept. The second important conclusion that Dr. Henry came to was that the potential harms of PSS are manifold. These include diversion of non-intended populations, expanded access and availability of opioids for youth, and normalization of this access, leading to risky use and reduced incentives for recovery, and uncertainty over long-term population level effects. For example, in increasing the prevalence of substance use disorder across the country.
Exactly. And that's what's going on. They're making it seem so normalized. You're frozen on the screen. I can hear you, but you're frozen.
Yeah, I see I'm frozen.
They're making it so normal and trying to brainwash. I liken it to brainwashing everybody in either to following suit with them, or you're against everything and you are a monster, because that's what they're trying to label us as people who aren't part of it, and we're breaking all the hard work that they've put in place. Well, they are nothing more than a glorified murdering factory as far as I'm concerned. And that's what they're doing. I have, my brother has died also of a fentanyl overdose, like Tina's son, Ben. And this is what we are doing to help other people not go through what we've went through. You don't want to have the experience of losing your loved one. That was Tina's only son. This was my only brother. And when we think of, if they didn't have a program like this and didn't make society so brainwashed that drug use is so acceptable, our families might still be alive and your families might be too. Hopefully, can you hear me, Tina? Yeah. Okay.
I can hear you perfectly. You can't hear me, but you carry on. I'm going to pop out and pop back in.
Okay, I can hear you, but yep, you pop out and pop back in. That'll fix it. In the meantime, I will pick up reading and we'll go from there, because this just came out. It was sent to me by a doctor, and this is doctor's information. It's an actual doctor study, and I like to supply all of our information so you guys can also enjoy it on your own leisure without us reading it. Again, the admission of Safe Supply's vast apologies. The second important conclusion to Dr. Henry came that was the potential harm of the prescribed Safe Supply manifold. All right, so Tina did read that. Expanding access, availability of the opioids for youth, and the normalization of the access leading to the risky use and reduced incentives for recovery. That reduced incentives to recovery, of course, it's reduced incentives to recovery. It's reduced because they can't get themselves straight to come off the drugs. They're being fed the drugs. What is the incentive to come off of them if you've got someone who's going to give you a regular supply of them? That's the problem. So it's really reducing the ability for people to come off of them, because as when we had Dr. Milburn on the show a couple of podcasts ago, Tina and I, what happened, as Doctor told us how hard it is for somebody to come off of it, but yet there's never been a reported incident of anybody dying from coming off of the drugs. Never. He's been, head of emergency department for 20 years, and he's seen it all in his experience as a doctor, and he's still a doctor. And like I said, he said no one has ever died from coming off it. So I liken it to a woman having childbirth. It's horrible. You go through excruciating pain, and some women can go through labor for days. But at the end of all that pain, you're left with a wonderful life. In a mother's, respect, you've got a baby. In an addict's respect, you've got sobriety. So it's a rough road, but it leads to an amazing outcome. And that's how we got to start looking at it, and not looking at it, I can't handle the pain. Yes, you can. You have no idea how much, resilience a person has until you're tested. You got to allow yourself to be tested to get to that point, so that you can become somebody who's recovered rather than somebody walking around in this zombie apocalypse they're trying to make normal. So if you've still got your document up, Tina, we're going to go ahead and start with page 4, the paragraph starting this admission of safe supplies.
Okay, I'll take it from there. Sorry
Yeah.
about that. This one particular computer I have just clunks out every now and then.
No
Okay.
worries.
So the admission of safe supplies' vast potential for harm is stunning, particularly when one considers that some physicians, myself included, who have warned the potential dangers of the unwitnessed PSS program have been accused of moral panic and of blatantly politicizing the issue. In truth, we have been standing by our duty as doctors to do no harm by considering all of those who may be negatively impacted by the unwitnessed PSS program. Dr. Henry's admission of the program potential harms is gratifying, but it is also unsettling.
Mhm.
Perhaps most unsettling is Dr. Henry's third significant finding that research into these potential harms is virtually non-existent. Some diversion is occurring. However, the extent and impacts are unknown. Although there is a team evaluating the efficacy of PSS itself, systematic evaluation of potential unintended consequences is outside the scope of the current evaluation, which is unbelievable that we have gotten to this point that, yeah.
What the part that really irritates me about this is that when you have the safe supply people that are running those programs saying that their programs are based on evidence, they're blatantly lying, because we're seeing here there is no evidence. These 71 plus doctors in BC are saying there's no evidence. So who's lying here? The doctors and the province where it all started from, or the people trying to keep their jobs and push this onto society as normal?
Exactly. I was watching a safe supply group speaking from Labrador there last night, and they're giving out crack pipes, and so I think, like, okay, at what point is it okay for my taxes to go towards crack pipes for people who want to continue using drugs? Like, I don't agree to that. And I don't see a study that says, it's beneficial to do that. Yeah, we have a post at Guardians today. It says that the government of Newfoundland spends more on free crack pipes and safe supply and drug den shelters than it actually does on our rehab, because we got an ATIPA report back that identified exactly what was spent in detox and rehab. I mean, there's not enough money going into those solutions for recovery to even have enough people hired, let alone have people going through, being able to get care when they need it. It's the reason why we have lineups. It's the reason why people can't get into detox. Take all of that money from the drug den shelters and the crack pipes and the supplies and put it into detox. You might get to detox and require some level of, harm reduction, whatever that might be. You may need to get on Suboxone or methadone for a certain period.
You need to wind them down, not keep them on a same supply forever, methadone forever. They need to be rolled back every week, less, until you're done.
Exactly.
Done.
Because really all you're doing is just putting drugs on top of someone's life, and they're a slave to that drug.
They are. And it's just time that we stop this method that we see is killing our kids. It's killing our grandkids, and it's going to wipe out the next generation if we keep normalizing this as the next new thing. It's not normal, and I don't want it to be the next new thing. It's already, showing how horrible it is.
Yeah. So when Dr. Henry says that it's unsettling because the systematic evaluation of potential unintended consequences is outside the scope of current evaluation, that's what I call government speak for there's no evidence to substantiate. There is not even a current evaluation to substantiate what our decisions have been. So that's out to lunch. Like, that is seriously, when you have people all over the streets for blocks and blocks who are zombies that we're not taking care of, who don't have capacity to make a decision to save their own life. We're treating them like dirt as compared to someone who has dementia, for example, or cancer or a heart issue. We're leaving them to the streets as if they can decide or fend for themselves, which in the majority of cases they can't, and that has yet to be proven too. But the proof is in the pudding. If they could make a decision, they would make a decision.
It's true.
It's infuriating. Okay, would you like me to carry on?
Oh, yes.
This is a shocking reversal of what we've been told for years. In May of 2023, for example, BC's chief coroner, Lisa Lapointe, assured British Columbians that authorities are closely monitoring continually for any and all trends that may impact public safety. That same month, Lapointe also referred to concerns about PSS diversion as an urban myth. So get your information together, people. What is it? Is it, I don't know, it's just a big mumbo jumbo. And besides that, human lives are not to be meant to be experimented with. It is staggering to learn the truth that not only is diversion a very real problem, it's also not being monitored at all. Given this lack of oversight, it is not surprising that stories of real harm happening to real people because of diverted PSS drugs are easily dismissed as anecdotal. It is impossible for anecdotes to rise to the level of evidence if no one is systematically collecting data. Together,
Well, sorry to stop you, but to have a program like this that is literally turning our population into zombies and giving out cocaine, heroin, methamphetamines, opioids, and they're not collecting data on it, that make your hair stand up on edge, because that's like going around doing this MAID program where people are signing up to get themselves killed, and then 10 years down the road, have 50,000 people gone. Well, do you have any data on it? Why did the people decide to die? Well, we didn't collect any data. This is something super duper huge, serious stuff going on here. And this should have had data collected from day one.
Yeah, absolutely. I'm with you 100%. Given the lack of oversight is not surprising. Oh, I already read that. Together, these three findings in Dr. Henry's comprehensive report should make us all take a step back and look very carefully at what we are doing. It is virtually unheard of for a potentially dangerous medical intervention to be expanded beyond a pilot project without significant evidence showing efficacy and similarly significant evidence showing an absence of harm. Like I said, we have, approval systems in place in our country. We can't just take a product and put it on the shelves and say, you know what, everybody go ahead and take this. We have, restaurants that are monitored, kitchens that are monitored, foods that's monitored. And on top of that, us as taxpayers are paying for all of this, which is infuriating beyond belief.
Exactly. So you want to pick it up from when it comes to?
When it comes to PSS, we have neither. Meaning what we need urgently is not expansion of safe supply program, but a whole lot more research. I say this as a supporter of the concept of PSS in general, but only if safety is a priority. COVID-19 forced the province to roll out PSS in great haste in March 2020. And in those frantic first few months, a lack of evidence was perhaps understandable. But the program has been running for almost 4 years, and we should be drowning in evidence that it's working by now.
No, we're drowning in bodies.
Exactly. Until such time as we have strong data showing both efficacy and absence of harm, PSS must remain tightly controlled, rigorously monitored, and meticulously documented. And to do that, they would have to have brain scans and all kinds of data to show that those drugs aren't doing more brain damage.
Yeah.
Right? Well, show me the study that's going to show me that continuing to give someone cocaine or meth or MDMA or all of the above
Mhm.
is actually
Helping.
them. That's never ever going to materialize.
No. This whole program is a hoax. It's an absolute hoax. It's like a drug person's paradise life. And I just can't even believe that we're having this conversation today, discussing this, because it just seems so far-fetched. How did this happen? How?
We've created a society of enabling is what we've done. And we've done it across the board in many, many ways. And we've done it to our youth. And why are our youth being decimated? That's the reason why.
Why? Exactly.
And
So-
it's ridiculous because our youth, we have developing brains that don't have, the cognitive, intellect to be able to see the long-term picture and make decisions. It's crazy.
Well, the thing is, though, Tina, is when they see that governments are supporting programs like this, it makes the children think that it's safe because they're told their entire life to trust your government. Well, this safe supply program leads me to question exactly how much my government feels about my safety of my children and my grandchildren, because I am extremely concerned that if this program doesn't come to a complete end, where will our population of our loved ones be in 10 years' time? We're going to be going to funerals instead of going to birthday parties. You want to finish this one off?
We already are going to funerals.
More.
Yeah. So rather than expand the program, we should enact every safeguard possible to ensure the program is not doing more harm than good. Finally, we must all remember that to demand evidence is not fear mongering. That's the point. That's the point. And the people who come back with this are very manipulative and trying
and
to.
A lot. They're paid a lot of money to say these things to us, Tina. These people.
Yeah. Yes, you and I don't get paid for talking about this right now. We are independent people who have been impacted, lost our loved ones as a direct result, and we're willing to tell the truth about it. But all these other people who are substantiating it, they're on the payroll. Number one, they keep their jobs by continuing that. They get to build organizations that continue that narrative and build their organizations, all these nonprofits all over the place. And it's at the expense of our kids. Our kids are dying across the country. So finally, we must all remember to demand evidence, and it's not fear-mongering, and it is not politicizing, and it has nothing to do with moral panic to demand evidence as, in fact, the very basis of a scientific inquiry. Exactly. As a physician and a citizen of British Columbia, it's not only my right to demand such evidence, it's my responsibility. And then it was signed by physician after physician, a lot of them in Victoria, and as you said, many, many different physicians in many different roles. Okay. And it's super important. This should be on the front page of the Globe and Mail. It should be on the front page of the National, because what people need to realize is all these harm reduction, I don't know how to describe it, but like you said, how we got here is unimaginable.
They're brainwashers. They are politically using their platforms, their organizations, programs, all the nonprofit, all the monies that are coming in, they're using that to spread bad information that doesn't take place. You've just seen there is no scientific evidence. There is no doctor saying that they have any data. It's lies. And our taxpayers are funding lies that are killing our kids. They're dying. You've got a lost son. I've got a lost brother. And if we don't all speak out, and if we keep allowing them to be overheard more than us, they win. And if they win, our families die.
I think a big part of it is that taxpayers don't realize that your taxes right now are going to pay for heroin, right? Cocaine, crystal meth, hallucinogens like MDMA and LSD and marijuana. Your taxes, you wouldn't go out and buy your kids those drugs, But
No.
right now, your taxes are going to pay for those drugs for people who are already in addiction and desperately need recovery. So instead of using all that money, what was it, 300 million from the last expenditure of hydromorphone in
Yes.
BC? All of
That's
that. Imagine what we could do with $300 million worth of recovery and rehab centers. I had earlier on today, I had a podcast with a doctor who is creating recovery cities and villages and cultures. That's what we should be building,
Mm-hmm.
right?
Exactly.
And he said, you know, like as his primary indicator of people's recovery is inclusion into a community where they feel like they're actually at home, have a sense of purpose, have a sense of contribution, and they feel a part of instead of isolated. So what are we doing? Instead, we're decimating the country with drugs. We're creating more and more isolation between people. We're exacerbating drug use. We're using taxpayers to do it. And we have everybody knows what kind of an apocalypse is happening
The
in
results are alarming, and not in a good way. They are alarming in a, oh my God, run and hide. This can't be where I'm living. This can't be Canada. And yet here it is.
And you know, I've done presentations and things, and people say, well, why? Why is this happening? And there's lots of reasons why. You know, we have a whole drug trade now based on prescription supply. We have a whole entire nation that's created a drug culture. How beneficial is that for the drug pushers in the country? Right. Whether it's legal or illegal, it works both ways. Even if it's street drugs, they've found a way to take, you know, prescribed drugs and turn them into street drugs. So all roads lead to addiction.
They do. And like you said, we need to get all this money rerouted into the detox, the rehab, and the mental health, because if we don't start saving our people, who will? Because they won't. They're making a fortune off of killing our next generations. Okay? It's not going to help if we all don't start taking notice and being more proactive into how things our tax dollars are being spent on. And Pierre Poilievre is taking an active approach. He is one of the only politicians out there speaking about safe supply drugs right now, because people are just so ready to tear you a new one when you say anything negative against it. I have literally never had so many people attack me about, you know, on Facebook in the last couple of months when I became involved in stopping and you know, aggressively coming against this safe supply program. I've never had so many death threats. How many people inboxing me, just vocally trying to tear me apart on Facebook, on different groups, because I'm against this program. Yeah, I'm stepping up to save your loved one. I don't care who doesn't like me about it. That's not my problem. My issue is my brother is dead, and I'm not going to have other people, you know, I'm not going to sit back and let other people die because other people think it's okay. It's not okay.
Your position is noble, and people should be thanking you for it. And the people that aren't have a vested interest in keeping the drug epidemic the way it is. And who's that? That's drug dealers, that's drug pushers, that's drug users. So all those people who are negatively saying things to you, forget them, because at the end of the day, they're the people that are exacerbating the murders of our children.
And they're the ones that are going to have to live with it in the long run, because there is going to be some evidence. One of these days, that evidence will be collected, and it is going to be, well, I'm just going to be so happy the day that they start closing all of these places.
Yeah. Well, some of those things are starting to happen in Nova Scotia now. Didn't you guys have some recent closures?
Well, yesterday we had an announcement of a new mental health and addiction center opening in the hospital wing in North Sydney. And North Sydney is one of the areas on Cape Breton that has been heavily inundated with intravenous drugs. So it's very good to see. It's been a long time coming, and I hope it's the first of many. We need them in Sydney and Glace Bay and New Waterford. We need them all over Cape Breton. We need them all over Newfoundland. We need them all over Canada. So I am super happy to say that, yeah, yesterday there was a win here in Cape Breton with one of the mental health and addiction centers opening. Yay!
Fantastic. And what's happening with the center? You and I went through their brochure one time. I was flabbergasted at what they are doing there, and with society and justifying it. Any news on those folks?
Those folks are still running strong and still doing what they want to do. They're still brainwashing people into thinking that their program is the best program and the safe injection and safe supply is the way to go. And, basically, if you're not high, why is what they're pushing, right? And I'm not for it. Yeah.
Right. Well, these letters, the one that we just wrote, and I think more doctors across Canada should do the same. And if there's anything that could or should come from a show like this, is to alert doctors to say, hey guys, it's time for you to take a stand and to tell the truth and to start acquiring data and evidence within our own jurisdictions, and to actually get some hard data on the table and find out what's working and what's not working. I'm sure there are certain things that help, right? Like maybe, getting a Hep C vaccine. Like I had no idea that was even a thing when Ben got sick. I didn't know he was going to be on the streets and contracting Hep C. But someone right off the bat, he had just turned 16, and someone said, do you want Ben, or he was 15, do you want Ben to have a Hep C vaccine? And I was like, why he's presenting with addiction. Why would he want a Hep C vaccine without knowing what he was about to come into? And then in that same center, he learned how to get emancipated and go on the streets. And what did he do? Get a Hep C. Like there's so much, misinformation. To me, harm reduction would have been educating the whole population about Hep C right now, and the likelihood of people getting that as they use drugs and end up, on the streets using, when they go to social services, there should be, what's harm reduction? Telling people that when they leave telling kids when they leave their safe homes, the probability of them being drug addicts, living in trap houses, having to prostitute themselves, stealing, going to jail, contracting Hep C, contracting HIV. These are the things that safe supply or safe programs should be doing. Educating people to the harms of what's to come if they continue using drugs, and providing them an avenue to go into recovery or detox and recovery rehab, and not rehab like an institutional rehab. It has to be a place of inclusion. It has to be a place that people feel good about. We want to create recovery resorts, not, and like David said on the show earlier today, creating, cultures of where people feel at home and included. Like the basic things that we all want is to feel included, to feel good about what we're doing, to make a difference, to be able to have a purpose of work. These are all the things that support recovery. Have a safe home. That's what we're doing at Guardians of Recovery, creating people's forever homes where they feel a sense of inclusion. Well, if we have all these recovery homes in a village, and we have a recovery village with recovery cafes and recovery Olympics and recovery, activities and recovery, the arts and dance parties and everything, sure, who wouldn't want to be there?
Because when you're high, you're chasing a feeling of fun and awesomeness. And if you're giving them that feeling of fun and what they're doing is awesome without the drugs, and they're on a natural high, that's what we want to offer them, is that inner feeling without having that outer feeling and getting it from the outside. Taking something to feel that good. You'll be in an environment that's going to contribute to those good feelings. I want to thank Dr. Chris Milburn for supplying the information for today's podcast. He is on Paradox at substack.com. If you want to learn more about the opioid epidemic, you want to learn it from a doctor yourself, him and his wife have a great podcast that they do. Again, it's Paradox at substack.com, and you will learn all sorts of information. And he's great to supply us with information and education. So I just wanted to thank him for that. Anything
Yeah.
else you want to add before we close today's show, Tina?
I would. I'd like to encourage everybody to start looking into the future and start dreaming about what we can create. We're creative individuals. What kind of cultures can we create? How can we bring our cities, towns, municipalities, governments into building the environment and the culture that everybody wants to live in, that is happy, united, and connected? What does that look like? As soon as we start doing that, we start winning the war against illicit drugs.
Exactly. So with that in mind, guys, if you've got any information that you would like for Tina and I to share and bring to light of the public to help save people's lives, by all means, reach out to Tina at guardiansofrecovery.foundation. Reach out to me here, Janet Dermody at Cape Breton Originals, and we would be happy to help you, help enlighten everybody else, and spread joy, spread soberness, and get people off of these drugs that are destroying them and their families. Thank you again for tuning in. Please share this video if you like it. Have a great day, guys.
Thanks, Janet. Bye.
You're welcome. Thank you, Tina.